Welcome to this presentation. My name is Louisa, and I am a counselor with Senior Community Services Pennsylvania Medicare program of Delaware County. We are a group that does all kinds of Medicare counseling, and we have an excellent group of volunteers and an excellent director who offer Medicare counseling. So today we're going to go through the process of going online to find the best Medicare Advantage plan or drug plan, which you might do either for yourself or for some Medicare beneficiary that you are helping. This process is referred to as doing a plan comparison, and it is a vital skill because not only can you use it, or does someone use it when they first sign up for Medicare and have to choose the parts of the plan that they want to go with, but it is important to check either your Medicare Advantage plan, if you've gone that route, or your Medicare drug plan, if you've gone the traditional Medicare route, every fall during open enrollment season, which is October 15 to December 7. You'll know it's open enrollment because you see lots of ads on TV for Medicare Advantage plans. You want to check every year in that time period to be sure that you still have the best plan for you, despite whatever changes have been made in the plans for the coming year. And they always make changes. One year I was working with a woman who told me, I said, can we do a drug plan comparison for you? And she said, well, I was perfectly happy with my plan last year, and the agent called me and I signed up again. And so she didn't really want me to, but I persisted. And I said, well, how about I just do a check? And if the difference in price is significant, I will let you know. Well, the difference in price, now this was a woman who took a lot of drugs, which was why I persisted so with her. The difference was over $20,000. That just blew me away. So that's atypical, but still, you will save money for sure in the long run if you check your plan every year, and it can be significant. It's often in the $300 to $400 range. Well worth it, I would say. And it's not that hard. So if we can move to the next slide, the first step in finding a plan is to go to the Medicare.gov website, and you click on the Find Plans box. You see the blue arrow pointing to that at the bottom of this slide. Once you click on that, it will take you to another screen, if we can move on, that has a button that says log in or create account. You see the purple arrow pointing to that. Then that brings up a new screen where if you already have an account on Medicare.gov, you just log in the way you normally would, put your username and your password. If you don't have such an account, I really encourage you to create a new account. And if you do that, obviously where that red arrow is pointing, you click on Create an Account Now. So you might ask, well, why should I even bother creating an account? One benefit of creating an account is that if you are looking for an Advantage plan, you will see later on in this presentation that there's a point in your search where you really need to log out and go call your physicians and providers to see what Medicare Advantage plans that you're interested in they accept, and then you have to log back in. So all your information gets saved if you have an account. This also helps even if you just have a drug plan, because it means every year your medications and your information is already in there. So you have much less to do than you would normally. And it will all come up for you. So the other reason, aside from making doing one of these searches way easier, especially in repeat times, is that Medicare.gov has a lot of information there. And if you log in and it knows where you live and what plans you're on. You can find out all kinds of things on Medicare.gov, and you can find out about your coverage, your claims. If you want to cut down on the amount of paper that comes to your house, you can do that. So anyway, I encourage you to do that. If you're going to do that, you will click there where the red arrow is pointing, create an account now, and then a new screen will come up that will have the questions shown on the left here. So you're going to need your red, white, and blue Medicare card. So you do have to be signed up for Medicare in order to create a Medicare account. To sign up for Medicare, you do that through socialsecurity.gov. But we'll assume you've got your red, white, and blue card. You're going to fill in those blanks. All the information on the left side is on that red, white, and blue card. When you finish that, you click the next button and you get a new screen that is like the right-hand side of this screen. And I think that's all pretty obvious. You fill it in. I will say there is no reason you need to give them your email address if you don't feel like it. You can just tell them you don't have one. That's a little white lie I think is perfectly acceptable here. Then you check that the information is good and you hit the next button and move on. Now comes the part that we all dread, I think. You have to create a username and password. Using your email address is perfectly fine here, or something else familiar. It really doesn't matter. Even if you just said you didn't have an email address, it doesn't matter. The password is the trickier part, as usual. It must be 8 to 16 characters long. It must have at least one uppercase and one lowercase letter, one number or more, and then only these particular special characters, which are most but not all of the ones across the top of the keyboard on a computer with your numbers. So the @ exclamation point, $, and they'll show you that it has to be one of those. But if you pick anything else, they won't approve it. So follow those directions. Then what I would say is be sure to write both your username and your password down somewhere on a sheet of paper for your records. Even if you have some system on your computer like LastPass that stores it, I would write it down somewhere else because you're going to need to take it with you if you are ever going to meet with one of our counselors. They're going to need that information to get in. So record what you have created and then put it in a place where you can find it. And then we can move to the next screen. Now you will use your brand new username and password, and you will log in. And then there will be another one that will say find plans, and you're going to click on that. At different times of the year, what you get looks slightly different because it is sometimes if you are a new Medicare beneficiary, you are looking for a plan in the current year. So if I were 64, turning 65 now, I'd be looking for a 2022 plan. When you look in the fall during open enrollment, say we're looking next fall, that'd be the fall of 2022, but what you would be looking for is a 2023 plan. So just be sure you're finding the right kind of plan. But that should be pretty self-evident, I think. All right, when the next screen pops up, it's going to ask you what type of coverage you're looking for. And you can see that right now, the only kind of coverage you can look for is 2022 coverage because we're not in open enrollment. So then you're going to check which one you are looking for. Obviously, if you're looking for a Medicare Advantage plan, you check where the blue arrow is pointing. If you're looking for a drug plan, you check that one. Then you put your zip code in and click continue. You're going to get the hang of this very fast. Those little green buttons are always somewhere on the page. And if you don't see it, you just scroll down. So you've checked Delaware County. Once your zip code comes up, they want to know what county you're in because these plans do actually vary by county, believe it or not. Then Do you get help? Maybe you do. If you do, you check the appropriate box here. I love the fact that they put, I'm not sure. I wish many other places would give you that option. Anyway, click the right answers here. When you've done that, scroll down, there'll be a next button at the bottom of the page. On you go. And now you get to my favorite question. Do you want to see the drug costs when you compare plans? Well, that's the whole point of comparing plans, is to see which one is cheapest. And you can only do that if you see the drug costs. So you click yes. Moving on from that, it will ask you to indicate, oh no, now it's going to ask you for your drugs. Okay, great. This is a tedious process, especially if you have a lot of medications. And we are only talking prescription drugs, no vitamins, no over-the-counter drugs, none of that. So if you are already enrolled in Medicare, your job is easier because whatever drugs you have already purchased on whatever Medicare plan you have will appear. However, if you are new to Medicare, you will need to add each of your prescriptions one at a time. This is, again, a reason to have an account, because once you've done this, you don't have to do it again. You just have to proofread it. So you're going to type in the name of the first drug that you purchased, whatever it is in your little list. And then there's a list that will pop up, and you will select that drug from the list. So it makes it easy. Once you've typed in 4 or 5 letters, you start to see options that might be your drug. Then they will ask you for additional information. What is the dose? Some of the drugs, there'll be a drop-down menu, and you'll have to figure out exactly what the dose is and find that in their list of options. And then you want to put in how many you are buying and how often. So for example, if you take 1 a day, you might be buying 30 every month, but you might also be buying 90 every 3 months. So, or every 90 days. So you have to fill all of that information in. When all the information for one drug is complete, where here it says add drug, there will be this green link to say add drug, and you will click on the green link and it will move you on to the next drug. So you're going to work your way through your drug list, one item at a time, until you have included every prescription drug you take regularly. Now, the steps shown on the next slide is for everyone. So even if your drug list was already in there, or if you just created it, you still want to go back and proofread it very carefully, because it is easy to make mistakes, but there are also mistakes that just happen in this program that you had nothing to do with, but you have to find. So make sure the name, that's the blue arrow over there on the left, the dosage, the type of thing, is it a capsule, a tablet, extended release, blah, blah, blah. Make sure all that is right. Make sure you've got the quantity and the frequency correct. And then if you see something that is an error, click on that edit drug. And then you can go back and fix it. After you edit a drug, you'll need to click the green add to my drug list button to get back to your full drug list. So and then you keep on proofreading. Okay, so go until you've gotten all the way to the end. Now, on the next slide, I have a list of things that you want to be really careful to look for, especially if you are an existing Medicare beneficiary, so that it was really the computer or Medicare that generated your list. The biggest place I have seen errors is on medications that are not pills. So first, you want to make sure that the names are actually the right things that you're still taking, and get rid of anything that is some kind of a duplicate or something you took once, but you don't really take again, or whatever doesn't belong. But especially look at the dosage and the amount for anything that is not a pill. Like maybe you've got some ointment. They have a way of thinking that you ordered 30 tubes of the ointment because you were using it once a day. You were not ordering 30 tubes. You wanted 1 tube for 30 days. So be very careful with the dosage and the amount. That is just a word to the wise. Okay, once you have done that, you're going to click that Done Adding Drugs button, green one at the bottom that big red arrow is pointing to. You're going to take a deep breath, congratulate yourself. You have really now completed the most tedious and annoying part of this application. Congratulate yourself, move on. Gets easier from now on, especially with a drug plan. Next, you are going to choose pharmacies. And one thing I urge you to check at the beginning, you can see where it says filter by distance 1 mile, kind of in the middle of the left of the slide there. I think it's now coming up as 5 miles, which is much more useful because it doesn't really know where you are in your zip code. So 1 mile from who knows where in your zip code is not helpful. So make sure you have a big range that it's looking in. But then you want to choose multiple pharmacies. And let me explain some of the fine points of this, because this is a key part really to saving yourself money. So first thing I would say, unless you never use mail order, I would click on the mail order button at the top there where you can see that's checked on this slide. Because sometimes mail order is cheaper. It doesn't mean that you have to use mail order. It just means that that's going to be one of your options. And it might be cheaper for most things. Then you want to choose 3 to 4 pharmacies near you. And your goal here is to select multiple pharmacies that are reasonably convenient so that you will end up with what the Medicare program calls preferred in-network pharmacies, because those are the places you will get the best prices, and it can make a huge difference. Good options for preferred pharmacies are usually CVS, Rite Aid, Save On at the Acme, Walgreens, Walmart, even Costco. If you have a favorite neighborhood pharmacy, feel free to click that, and then you can see where its prices are more expensive, how it compares, and decide if it's worth it to you or if it's worth it for certain drugs and not others. And what you click here has nothing to do, it doesn't limit where you can go in any way. It's just going to guide you to where to go in order to save the most money. That's the whole point. Once you have clicked buttons the way it is clicked here for mail order pharmacy, that little blue check in the box, you do that for 5. They will show up across the bottom the way it does here. And then you'll click that Done button that the red arrow is pointing to in the bottom right corner. The next screen that comes up will show you the beginning. If you scroll down, it will have a whole list of either Medicare Advantage plans available. You can see that's what's here. It says on the left, showing 10 of 54 Medicare Advantage plans. Or if you ask to see drug plans, that will say showing 10 of so many drug plans. For either drug or Advantage plans, first check in the upper right-hand corner to be sure that where that red arrow is pointing, that it says lowest drug and premium cost. Sort the plans in that order, because that's what you really care about. The total cost to you for the year. You don't really care if you pay a higher premium, but you get your drugs cheaper if the total is less than if you pay a lower premium, but your drugs are way more expensive. You care about the total for the year. So that's how this is going to rank these plans. They are only ranking them in order of the retail pharmacy. The mail order pharmacy is not included. It can only rank by one thing, and they chose to rank it by the total retail drug plus premium cost. So you'll see how to work around that in a minute. But so if you are already on Medicare, the first plan that pops up here at the top of the list will be the plan that you are already on. And actually, in that case, that sort plans by box with lowest drug and premium costs will be under your current plan. So you'll have to scroll down a little. Okay, now that you've gotten to the right screen, from this point on, the process differs a little depending on whether you're doing a drug plan comparison or a Medicare Advantage plan comparison. If you could move the slide up one, that would be good. Since the drug plan, Glenda, can you move the slide? Thank you. Since the drug plan there is simpler, I'm going to review it first in the next several slides. It's maybe 6 slides. And then I will go back and explain the parallel process for Advantage plans. So if you're only interested in comparing Advantage plans, if you're watching this online, you can just advance 6 slides or hang on there, and then we'll be back to explaining how to do it for an Advantage plan. So moving to the next slide now, for those who are comparing drug plans, this is the drug plan equivalent of what we were just looking at. You see how in the top left it says showing 10 of 25 drug plans. Still has sort by lowest drug and premium cost in the right-hand corner, because this is somebody who is not yet on Medicare. So the first plan that came up was the one with the lowest total drug and premium cost. You want to look quickly at the star rating. That would be where the top red arrow on the left there is pointing. That is relevant if you're coming down in a close call, or if you saw that the star rating was really terrible, but not usually that important. Next line is the monthly premium. Important, but as I said, the more important thing is the total drug and premium cost for the year. So you can see in this one, the retail pharmacy total for the year is $313.80. And it may surprise you that that's cheaper than mail order, but that has become often the case. However, you want to scroll down at least 5 or 6 drug plans to see if there is any one where the mail order total is less than whatever the cheapest retail one is. That's the first one that comes up, because that's possible. Doesn't happen often, but it does happen. And if you're a person who's happy with mail order, you want to check that. Then you want to look and see if there is a deductible. There is not always a huge deductible like this, but there usually is some deductible. Okay, let's think. What else? If you think this looks like a possible plan here, you want to check that add to compare box that the blue arrow is pointing to. And then the plans that you're trying to compare will appear across the bottom of the screen the way that it is shown here. Once you have gotten 3 plans, then that's the most you can compare. Then you want to click the white compare button in the bottom right there. And that will bring up a new screen that we'll see next that is your actual comparison. Can you see we have the 3 columns here for the 3 plans that we chose to compare. And as you scroll down, you'll see more information. The part that you most want to focus on is down there in the bottom where it says drug coverage and costs. Because what you are trying to look for here is to see, remember we talked before about wanting a preferred pharmacy, preferred in-network pharmacy actually. because that's where you will get the prices. So if you look at these, you can see under the bottom of Clear Spring, it's listed the Rite Aid, Walmart, Patient First. 2 of those are preferred. The first one that the red arrow is pointing to, Rite Aid. Second one, Walmart, also preferred. Then Patient First Devon, that's more of a neighborhoody thing. You see how much more expensive that is. But then look in the middle column there. The Rite Aid is not preferred in network, it's standard in network, which makes it sound good, but that is not good enough. And you can see, look at that. It's not quite twice as much, but it's a lot more. Walmart is a whole lot more with that middle plan than it was over there where it was preferred. And Patient First continues to be expensive. So if you have a plan that has no preferred in-network pharmacy, you want to try to change your choice of pharmacies so that every plan that you might consider will have a preferred pharmacy. So you've already seen here, okay, Rite Aid was a good choice, Walmart was a good choice, and then over on the right, those are the same 2 again that are preferred. So you might go back and add in different ones from whatever you added in before so that you have some more choices here, because you want to come up with, so you're comparing 3 plans, each of which has a preferred in-network pharmacy. That is really your goal. Okay, I think the next thing that you are going to do is when you open the plan details, you will see a whole variety of things. And this is how you get to where you're going to change pharmacies. Let me comment on one thing over there on the left where the blue arrow is pointing. This is a new feature that Medicare.gov has put in where they can help lead you to some kinds of extra help to lower your drug cost. So they might tell you, for example, in Pennsylvania, there is a state program for people over 65 called PACE. They might give you information about how to contact that, but they also have information about specific drugs and how to get an extra help in some way with that drug. So that can be very useful, especially if you have one drug that is really extraordinarily expensive. They'll tell you what the limits are. So I'm just pointing that out. If you were trying to go back and change your pharmacies because you didn't end up with the preferred in-network pharmacy for each of your choices, then you click that Change Pharmacies button that the red arrow is pointing to over there on the right. Let's go to the next slide. If you've clicked to go back to finding pharmacies, on the second go round, you can make your work much easier by clicking that little box that the red arrow is pointing to the sentence that says show only preferred in-network pharmacies. So that is way helpful. I don't know why you can't do that the first time, but you can do it now. So it only appears when you go back. That should help you find good pharmacies to choose. So you have gotten to the point where each of your possible first choice plans has a preferred in-network pharmacy. Once you've got that fixed, on the next slide, you can see your comparison will look like this. At the bottom, you'll have your 3 plans, and you can see in here, each of these plans has at least one preferred in-network pharmacy. So this is the screen where you're going to figure out which plan is best for you. What's the most important factor in your decision? Obviously, that total drug and premium costs. So see how it says that over on the left side? You want to scroll down until you see estimated drug and premium cost. Then you get out your magnifying glass, because man, we are in the fine print here. And you hunt around, see if you can figure it out here. Take a look. What is the cheapest option in these three plans, what would be your best bet to save money? Did you find it? It is over on the left in the WellCare plan. If you look all the way down at the bottom, the mail order is the absolute cheapest. On the other hand, for a tiny bit more, going to the Save On pharmacy is also quite good. Save On at the Acme. Notice the difference between the cost at the preferred pharmacy, like Save On was $65.62. Then if you went instead to CVS, you'd be paying $191, almost $192. So that's a significant difference. And imagine if you were taking more drugs than this individual was, whose total cost here is relatively low. Now you see why finding a preferred pharmacy can be so important. Most often you can easily spot the lowest cost, make your decision just based on that. So here, if I was perfectly happy going to the Save On at the Acme, I'd be going with the WellCare because all the other ones are more expensive. And I might use mail order for some, or for another $1, I might just go to the Acme. Who knows? Now, what if you don't live near an Acme or an Walmart? They're possible, but they're, 5 miles away. And there is a Rite Aid that you can walk to. You might decide that the difference between the $65 for a year at Save On and the $89 at Rite Aid over on the right with ClearSpring was worth it to you. That's a perfectly reasonable choice. Or maybe you've been using Rite Aid in the past. This is an important one to consider. And you don't want to go through the hassle of getting new prescriptions, which you would need to do probably if you switch pharmacies, or you'd at least have to get them switched over. That might make it worth a little higher cost at Rite Aid. That can be even more important if you have some prescription that required prior approval. You will know that's not the simplest and speediest process, and so that can make it worth staying at a pharmacy where you have been and paying a little bit more. Again, it's a personal choice, but at least you're weighing your options. Maybe, unlike in this display, but maybe there are two plans with similarly low totals for the year. That's the place you might want to go back to those details and see which one has a better star rating. All right, hopefully by this point you've looked, you've seen what's the cheapest, you've assessed whether there is any reason to go with something more expensive, whether convenience or simplicity with your prescriptions. You make your plan. Now move to the next slide. Once you've made your decision, it is very easy to enroll. You scroll back to the top of that plan comparison, and you see under each plan, there's a blue Enroll button, and you just click on the Enroll button for the plan you want. You complete their application, which is not very complicated, and you're done. Simple. If you have a drug plan, you want to do this process every fall. Okay, take a deep breath, stand up and stretch for a second. This completes the details of the drug plan comparison. The stuff we did at the beginning through the pharmacies is good for both kinds of plans. Now we will go on to the more complex process of choosing between different Advantage plans. Drug searchers, stay on. This is a little more complicated, as I said, but there are important notes for you, again, at the very end of this presentation. Advantage plan searchers, if we go to the next slide, you will see that we are back to where we were before, where you were looking at something that said showing 10 of 54 Medicare Advantage plans or something similar to that. See the red arrow pointing there? So the first thing to consider as you are looking for an Advantage plan is whether you only want to consider certain types of plans. So you'll see I've put a blue arrow there at the top of the screen right under the heading, and it's pointing to a box that says select a plan type. Click on that box and you will get a drop-down menu that we will see in the next screen. The drop-down menu lists these types of plans. The first type of plan is an HMO. You may be familiar with one of those from whatever kind of insurance you had when you were employed. An HMO plan is one where you must use physicians and hospitals in their network. Most Advantage plans are HMOs. But there are some plans that are labeled PPO, the second box there that the blue arrow is pointing to. A PPO is different from an HMO because it gives you flexibility to use out-of-network doctors and hospitals at a little higher cost than in-network doctors and hospitals. Some people who are looking for an Advantage plan only want to see PPOs because they definitely want that kind of flexibility that a PPO offers. If you want to see both kinds of plans, ignore this altogether. If you only want to see PPOs, check the PPO box. I think we don't even have to talk about the rest of the options in that list. So let's move on to the filters, because you see all these filter choices. Actually, I would say the bottom line is you probably don't need to check any of these, but let's just go over them quickly. The first set of choices there that you see the drop-down menu for are the various kinds of plan benefits. So if there is a particular benefit that you definitely want, I would click on that and then click apply. However, the plan benefit information comes up in most of these plans anyway, or it comes up, so you can see pretty quickly whether they do or don't have what you want. But if there's something that you really need, then I would go here and click on that button. The next one is insurance carriers. I suggest you ignore that altogether unless you, for some peculiar reason, are looking for a particular insurance carrier, but that's rarely the case. The third button is for drug coverage. I would suggest you go in there and click on include drug coverage and apply, because it's much easier to have an Advantage plan that covers all your needs. Most of them do, but you want to be sure you get that. The next filter box there says star ratings. That might be tempting. You might want to always have a star rating of at least 3, but I suggest you skip it for this reason. There often are new plans that are too new to have a star rating, and that would be perfectly fine. And and the star rating is not always that important. So I would not fiddle with that at all. The one you might want to look at, depending on your needs, is the last one there that says special needs plans. You would need to select this one if you have some chronic condition that requires special drugs or treatments, such as end-stage renal disease. Or if you have Medicaid, you would get special needs plans. But absent that kind of thing, I wouldn't worry with a special needs filter. All right, let's pretend that you've checked whatever filters you need. Then we're going to move on to the next screen. And what you want to do is to scroll through the first few Advantage plans that come up, because they are in order of the lowest total drug and premium cost for the year. However, when you're talking about an Advantage plan, that is only a small piece of the total cost to you for this Medicare coverage. So that's why this is a more complicated choice. All right, here we are. First, over there on the left, you can see in the title here, we are looking at an HMO. If you're looking at a PPO, it will tell you that. So notice that with the plan, because if it is a PPO, it will be one with more flexibility. Take note of the star rating, because that can be important. If you has a really low star rating, I would urge against it. Okay, then you want to look at not so much the monthly premium, although do notice with Advantage plans, you see there how under monthly premium, it says doesn't include the $170.10 standard Part B premium. Be aware that everybody pays that unless you have some kind of extra help because of financial need. So when Medicare Advantage plans advertise zero premium, don't be thinking that you're somehow paying zero, because everybody pays the $170 Part B premium. All right, then what you want to look at is that next part, the yearly drug and premium cost. That's just like looking for a drug plan, see how that works out. Then another thing I would urge you to look at, which I'm actually not seeing on this slide for some reason, but that would be the maximum that you pay for health services. We'll see it in some other slide coming up. There is an annual maximum. What that means is if you get really sick, an Advantage plan can be expensive because in all these Advantage plans, you have co-pays as you go along. You can see over there on the bottom right, co-pays and co-insurance. In this particular plan, there is no co-pay for a primary doctor, which can be typical, but there is a $40 copay for every specialist visit. And you will find there are other co-pays for every kind of procedure or other visit. And there are especially big co-pays for days in the hospital or days in a nursing facility. So if you get really sick, there is a maximum outlay for the year that each of these plans puts in. So there is some guarantee or limit past which you will not have to go. That's what that red arrow is supposed to be pointing to there in the bottom left-hand corner. And we'll see it again, but that can be an important thing because that does actually vary from one kind of plan to another. All right, you've looked at this part. As you scroll through, you can also see here are the plan benefits. When you see a plan that seems like it has what you want, just as we said with the drug plans, you go see on the next slide that you're going to click in the bottom right, the Add to Compare button, and then that will make a blue thing. Can we go to the next slide, Glenda, please? Once you've clicked 3 plans that you want to compare, they will show up across the bottom of your screen like that. The most you can compare at a time is 3. So once you've got those 3, then you want to click the Compare button. So it will bring up your comparison. Now you can look in more detail. Let's go to the next slide. When this pops up, at the top, you see the basic costs. You see the monthly premium. In this case, it's always 0. You see the star rating. Here's a good example of 2 all-wear plans that were too new. They don't have a star rating yet. You do see that this does not have deductibles. But then the next line is what I was just talking about. The maximum that you will pay for services with that first plan is $75.50. That's a big increase over the cap under the all-well plan in the middle, which is $6,700. Then over on the right, the all-well plan has a higher cap. But that's your reassurance that if you get really sick, that's the most you would have to pay in a year. Okay, let's keep going from that to the next slide. And This is what you see as you begin to scroll down on your drug comparison. So imagine you've got the names of the 3 plans there at the top. You're going to scroll down. You see here, okay, so we just saw this before, that the drug premium was 0. Then your Part B premium, remember I said you still pay that, so that's in here. Now you can compare these to see which extra services they have. Maybe there's one that's really important to you, and then you just want to make sure that that is in there. Keep on scrolling down even further until you get to the information about copays for various types of services. I think we see that on the next slide. Primary doctors, specialists, tests, lab services, etc. You want to look really carefully through that to identify which of all these things you are most likely to use. That is very different for different people. So this is why this decision is a little more complicated than the drug plan. Find the relevant copays for any service that you are likely to use in the course of the year, and sort of map out in your head, okay, how much would this probably cost me in copays? Also, even though none of us ever expects to be hospitalized, check what you see at the bottom there, inpatient hospital coverage. Check to see what that is, because that can vary widely. So for example, that one on the left, $170 a day for the first 10 days. So we're talking $1,700, where the Allwell one says only $350 per stay. And then the one on the right is almost $300 for the first 6 days. So you can see there is not a lot of consistency there. So that's an important thing to be aware of, because you don't want to expose yourself, even though you don't think you're going to end up in the hospital. And especially if you know, oh my gosh, I'm going to need such and such kind of surgery, then you really want to pay attention to this line. So you have to just make your own personal judgment here in these details. Which ones am I most likely to need? How will that stack up? How about just knowing for my own sake, if I get in the hospital, what's that likely to cost me under this plan? And then judge, and remember also, well, you've got the specialist visit, that's in here, that's a key. Figure that out, and then decide in what priority you would choose these plans. Which one seems the overall the best for you, the second best, the middle best, okay? Then keep scrolling down and you will get to the part about drug coverage. This is where choosing an Advantage plan is like choosing a drug plan. So on the next slide, you will see the drug section, drugs coverage and costs, it says on the left. And this is where, just as we talked about before, you want to be sure there's a preferred pharmacy for each plan. You saw back there before how big was the difference between preferred and standard pharmacy prices. It doesn't look so big here on the left, but if you look over on the right, it's a little bigger difference. This one's not quite as clear a description of that as the other plan we were looking at. But in any event, if you need to go back and change your choice of pharmacies in order to be sure that you have a preferred one for each pharmacy, you can see here the plan in the middle, there's no preferred pharmacy. So then you want to think, okay, what did I not choose before? It looks here like the person doing this didn't choose CVS, for example. Maybe you want to take out patient first and put in CVS and see if that makes that middle plan get cheaper. That's what you're trying to do. So in order to go back and fix your Pharmacies, you click on that Plan Details button. And then you scroll down in the details for that particular plan. Let's go to the next slide. And once you get into the plan details for that plan, then you can go over to that button on the right that says Change Pharmacies. And that will take you back to be able to change pharmacies. Let me mention again, just in case you tuned out when we were talking about drug plans, if you have financial need and you have a drug that is particularly expensive, or if you just need help with your drugs in general, that link that the blue arrow is pointing to is a relatively new addition to this site. And it can have really helpful information, both for overall help, like in Pennsylvania, there's a PACE program for people 65 and older. It can give you a link to that, but it can also link you to programs for specific drugs where you can get extra help or free or whatever. So that can be a very useful research tool, that little link over there on the left. Okay, now let's see here. I think we've pretty much done all that we're going to see here. If you clicked on the Change Pharmacies link, let's go to the next slide. That will take you back to this map where you were before. And this time around, you can see the red arrow is pointing to something that wasn't available to you the first time around, where you can ask it to show only preferred in-network pharmacies. So I would do that. It will make your job much easier in trying to choose the ones that are preferred. Then once you have made your choice, then you're going to ask to get your comparison again, and it will take you back to the next slide where you have your 3 plans. Now you have 3 plans that all have preferred pharmacies, so you're seeing the best cost information possible. Mark down, make your list for yourself with these relevant costs. So if you've had to change your pharmacies, go back and redo those steps we just talked about, where you're summing up what you think is the likely total cost for you for each plan for the year, and rank your 3 plans in order of preference. Which one do I think is best for me, second best, third best? All right. And note the exact name of each plan. You might have noticed as we were doing this, there are multiple WellCare plans, there are multiple Cigna plans, there are multiple Humana plans. So you want every detail of that title so you get the right one. Once you've made your list with the names of your plans and the order in which you would choose them, we get to the most important step of the process, shown on the next slide, finding out whether your physicians and hospitals accept the plans that seem best for you. Because there is no point in being in a plan that your doctor, or even one of your doctors, a specialist that you go to once a year, you don't want that person to not be in your plan. So you need to check with all of them and your hospitals that you would want to go to confirm which plans they accept. Similarly, if you are planning to try to use vision or dental benefits under any plan, be sure you check with those professionals to see if they accept the plans you are considering. I suggest you log out of Medicare.gov to make your phone calls, because it's going to take you a little while. And those phone calls are critical, as I said, because you don't want to be thinking that people are going to be in your plan and then find out that they're not. That will either mean you can't go to them or mean you're paying a whole lot more money. Both would be terrible. Okay. Once you've made your phone calls, then you're going to go make your final choice. Let's go to the next screen. And to do this, you will just sort of retrace your steps. You're going to go back to Medicare.gov. This time you have your username and password, so you can put those in, zip right along. You should be able to do it much more quickly because you've just done your whole drug list and edited that, and now you know your way around. So pretty quickly, and hopefully you remember which pharmacies you had put in, pretty quickly, you will get back to the slide that gives you the list of Advantage plans. Okay, now this time you only want to click the Add to Compare button on the plans that your physicians and hospitals said, yes, we take those, because there's no point comparing a plan that is not going to be good for you. So click the ones that they take. If you have to start over again, then click different ones, but scroll down until you have clicked plans that will work for you because they're accepted. Click that Add to Compare box. Then you will see a screen that will, like the next screen, that will show this Add to Compare box where you've listed 3 names across the bottom because you've checked 3 boxes. Once you've got your 3 boxes checked across the bottom, I think on the next slide we can see that a little bigger. Then you're going to click that Compare button on the right. This is a step you've done before, so you should be feeling really comfortable at this point. Once you click that button, the next screen that will come up, this is where you can make your final choice. You see your 3 plans. You can absolutely scroll down through the details one last time to make sure that you're making the best decision. Decide which one is best for you, but at least now you're only looking at ones that your physicians and hospitals accept. So you see which one works out the best. Then when you're at the top of the screen, each plan has an Enroll button under it. And once you've made your choice, you can click on that blue Enroll button and complete the Advantage Plan enrollment application. Or if you would rather enroll in person, you can call our PA Medicare MEDI office at 484-494-3769, and I'll give you that phone number again at the end. And our program director, Glenda Radical, can give you the phone number for the local representative for the plan you've chosen. So that can make the process easier if you would rather do it in that way. That completes the discussion of how to choose and enroll in a Medicare Advantage plan. But now there are important notes for everybody, whether you have a drug plan or you have an Advantage plan. First thing, both kinds of plans usually have a drug component. So remember, if you switch plans, or switch pharmacies, you may need to get new prescriptions because you've got a new pharmacy, and all the people you go to need to know what your new plan is. So you've got to tell your doctor, oh, now I have this drug plan and I'm going to this pharmacy instead of that other one that I was using last year. And certainly if you switch Medicare Advantage plans, you have to show everybody your new card when you go. I've probably harped too much on the importance of a preferred in-network pharmacy, but just remember, using that preferred in-network pharmacy is how you are going to get the best prices. You may absolutely use standard pharmacies, and they could be much more pleasant to deal with. They could be much closer to you. They could be more hassle-free, whatever. It might well be worth it, but just be aware of the difference. Moving on to the next slide, I would encourage you to mark your calendar. This is where an online calendar is so handy because you can just put it in for every year. You want to remember to do this kind of plan comparison, whether it's for a drug plan or an Advantage plan, every year during that open enrollment season, which starts on October 15th and goes to December 7th. You're going to be choosing the plan for the following year, but that is your only chance to be changing drug plans anyway. Advantage plans people have another opportunity January through March, roughly speaking, but you really want to do a plan comparison every year. If you need help doing it or you have other questions, here now is our phone number again, 484-494-3769. That is our SCS PA Medicare program local office. Maybe you're doing a comparison, you have a quick question, maybe you've tried it, but you would really like to talk to a counselor, just call that number and Glenda will help you out. And if you do go to a counselor at any time, be sure that you bring your Medicare.gov username and password with you, because as I said, you're going to need them, or the counselor's going to need them to help you out. If you would like, having watched this program, to get a PDF of these slides, it won't have the commentary, but you can see the slides. Then here is all of our information. Go to our website there. You see where it says PA Medi website, www.delcomedicareprogram.org, and you can get a PDF of all the slides there. If you have found this presentation to be helpful and you would like to watch another one about basics of Medicare, Medicare 101, we also have one on Medigap or supplemental plans, which are part of the traditional Medicare approach. And we have one on Medicare cost sharing, how to get extra financial help if you need it with Medicare costs. So I am actually the one who takes those reservations, and that is my email there, louisaaprize@yahoo.com. And I can tell you when the next program is on that topic that you might want to know. Also, if you go to our PA Medi website, there are lots of useful resources, and there are these recordings. You maybe went there to click on this recording, and there are recordings of our other programs. So if you want to do it at your own convenience, rather than waiting for a scheduled one where you have the opportunity to ask questions, that's really the difference. If you just want the information, it's right there on our website. So thank you for watching this YouTube video, and we hope it has been helpful to you. And I hope you will have a good experience with keeping on top of finding the best drug plan or Advantage plan, whichever one is the one for you, every year. Thank you.